All right, good morning. How are you this morning?
Not too good.
Not too good?
Yeah.
Oh, I'm sorry to hear that. What's
I didn't sleep very well. I was up.
up all night?
Yeah.
What were you doing up all night?
I went to go see my baby down in NICU.
Okay. All right. Well, I saw you. You just had a baby a couple days ago, and you're recovering from your abdominal wound from your C-section. All right. Sounds good. Well, I'll take a look at that in a couple of minutes. My name's Drew, and I'll be helping out your nurse today.
Can I take a shower?
Yeah. Anything I can get you right now so you can take a shower?
Yeah, I need some of those, like, panties.
Okay. Some of the elastic panties. All right.
Yes.
Sounds good. I'll run and get you some underwear. I'll be right back.
All right, thanks.
Yep. All right, here you go. There's a pair of underwear
Do you
for
have
you.
a package of 5? Because this is only going to last me, like, for an hour.
Oh, okay. Let me run and grab. I'll grab another whole pack for you. All right, there's packages. Should be about 5 in there for you, so you should be set for a little bit.
Much.
Yeah.
Okay, I think I'm going to take a shower now.
All right, sounds good. Well, I'll leave you to it. I'll change your bed while you're in the shower. So you got some nice clean linens to come back to, and after you get all cleaned up, I'll come and do my physical assessment. We'll do your 9 o'clock.
What about my pain and medication? Because I'm hurting.
I'll go check on it. I'll see what time you get it. All right.
Okay.
All right. Feel a lot better now?
A little, yeah.
Little? All right. Well, I'll.
Can you check on my pain meds?
Check on your pain meds?
My pain's like an 8.
Like an 8?
Yeah.
All right. Sounds good. Well, it looks like it's getting. Like it's about 8:45. I think they're for 9, but I'll go check on them. All right. I'll go check with your nurse.
All right. Thanks.
All right. Yeah. It's you got about 15 more minutes, and then we'll bring them in. We'll be doing our. I'll make sure and get a hold of your nurse, and we'll get your pain meds for you.
Okay.
It's about 15 more minutes till we can give them to you. Unfortunately.
Okay. All right. Thank you. Can I just like 3 cups of coffee and like 5 packs of artificial sugar and 4 or 5 creamers?
Yeah, let me go check on that for you. I'll bring back some
thanks.
coffee and sugar and creamer for you. All right, here's a cup of coffee for you. I'm gonna set it on your table. All right, and here's some. All right, and here's some sugar and creamer for you, or some artificial sweetener because you got that gestational diabetes. So there's some artificial sweetener.
Okay.
Make it nice and sweet for you. You want to do a physical assessment real quick?
Yeah,
or?
can you go check on my pain meds?
Go check on them.
About 15 minutes ago.
All right, I'll go talk to your nurse. I'll be right back.
Okay, thanks.
All right, can you tell me your name and birthday?
Paula Warner, 5/18 of 83.
All right, sounds great. Well, that's what I got on my med administration sheet. Here's your methadone. I'll go ahead and mix it up in the water here for you. And you drink that down.
Okay. You'll have to give me a minute because this stuff makes me kind of nauseous.
All right, well, I got to stay here until you finish it. So.
Okay. This stuff really makes me sick.
Yeah, well, if you get nauseous, we might be able to find some nausea medication for you. All done?
Yeah.
All right. All right. Well, I'm gonna go run out and go check with your nurse, get that documented, and I'll be right back and do a physical assessment. All right?
Okay.
All right. You feeling any better?
Yeah, a little.
A little bit. All right. How'd you rate your pain right now on a scale of 0 to 10?
It's probably a 4.
It's about a 4. All right. Sounds great. Well, sounds like those pain meds kicked in for you, making you feel a little bit better. So that way you don't have to focus on the pain so much, and you can talk to me a little bit. I'm gonna do a physical assessment on you, talk to you, ask you a few questions, get to know you a little bit better, and I'm gonna take your vitals and then check out that wound you got, and then I'll leave you alone for a little bit. All right? All right.
Vital signs normal?
Yeah, vital signs are little bit elevated. Your blood pressure's up just a little bit, and your temperature's up just a little bit from that infection. But your pulse ox looked real good. Respirations were about where they're supposed to be. So you're not too far off. Can you tell me your name and birthday?
My name is Paula Warner. My birth date is 5/18 of 83.
All right. Can you
Yeah.
tell me where we're at?
Yeah, we're at Cox North.
All right. And what's today's date?
4/20 of 2011.
Great. Can you tell me a little bit about your regular diet? What do you eat normally? I noticed your boyfriend was bringing in some McDonald's bags. Is that what you normally eat, or
Yeah, we kind of eat on the go a lot.
Yeah. Okay. Well, I noticed your doctor put you on a carb consistent diet with 2,000 calories. That's it's gonna be a little harder to keep on if you're eating McDonald's a lot, but if you can stick with it, it's gonna keep your blood sugar down. So I don't have to stick you with that blood glucose monitor, insulin anymore. And it's also going to help you lose a little bit of that weight. I noticed you had a couple of cavities going on there. How often do you brush your teeth?
I try to brush twice a day, but
If you'll work on that, make sure you brush your teeth at the very least once a day, and that'll help keep those teeth from rotting out of there. You have any problems going to the bathroom? No problems with your tummy or anything?
no.
No? All right. When was the last time you went to the bathroom? When was
What did you ask me?
when was the last time you had a bowel movement?
Yesterday.
Yesterday? You have any problems urinating at all? No? Okay. You sleep well at night?
No.
No?
I have to have something in me to be able to sleep. I was up all night. I went down to see my baby in NICU.
Yeah, I saw on your chart your baby was down in the NICU. Do you mind if I ask why he was down there?
They're trying to get him off of the opioids to try to wean him off because he's addicted.
Oh, that's no good. Was that something that you were doing while you were pregnant, or?
Yeah, unfortunately, yeah.
Yeah. Okay. Well, hopefully we can get him off of there. Are you doing anything for that as well?
Yeah, I'm going to the treatment center at least once a week.
Okay. Well, that's good. Yeah, I brought you your methadone earlier, so I was gonna make sure and ask you about that. Make sure you're trying to get weaned down from that. Yeah, you go talk to a counselor there about once a week, and yeah. Well, that's good. That's good. Hopefully you can get weaned down from that. That's no good to have to be on all the time.
I need to talk to the doctor because I really need something to sleep when I go home. I really need something that'll help me sleep.
Yeah. Okay. Well, we'll talk to him and we'll see what we can get for you to make sure that you're sleeping real well. I know with that baby, it's going to be a little tough anyway, but we'll make sure and we'll talk to him and see if we can get you helped out a little bit there. I'm gonna listen to your lungs and your heart for just a minute, and then I'll be all done. Let you get back to your nap. Make sure you get good and well rested before you go home. Take a deep breath for me.
What?
Ms. Warner, can you take a deep breath for me? All right, thank you. Listen to your heart for just a second. I'm going to take a look at that surgical wound you got there from your C-section, all right? All right, let's have a look. Okay, well, it looks a lot better than it did. It's definitely healing up, but it's still infected. You got a little bit of redness and some purulent drainage, so it's still showing some signs of infection, but it's definitely healing up. Dr. May will be in just a few minutes to repack that for you. And there's a fresh dressing for you. There you go. All right. And you ought to be all set up now. There you go. How are you feeling? That pain medicine still keeping you pretty comfortable?
Yeah, when do I get my focus at?
Well, I'll have to go check on that one and see when we can give it to you again.
Okay.
Yeah, the doctor's on his way over to see you in just a little bit. He's going to repack that wound and check it out, take a good look at it. Our original goal for your wound was for you to be able to take care of it, and since you're still having some problems leaning over and just getting around with it, we're going to look at some alternatives to you staying cooped up in here. So we're looking at some home health. Somebody that's going to come in and check out your wound on a daily basis and make sure that you're being able to take good care of it, making sure the infection isn't getting any worse, and then they'll be able to make sure that your meds are all staying straight and everything too.
Okay.